thought TV was not going to happen to me because of the very limited knowledge that I have of the disease. For those of you who never lost relatives to this fight or who never experienced this, simple question is, what would you do if your child, your niece, or anybody else gets diagnosed with TB now? What do you know? What kind of help will you give? These are the questions that should trigger and you should go out there and find out more. Because when it comes to the stigma and people shying away, and I think that stigma causes people, and it's a barrier to better health care. It's a barrier to develop a certain area, whether it's a country as such. And because of stigma, you find that some people, they just choose not to care. And care is the thing that you need the most, because through caring, one can make a difference. So it's really important that even if you're not involved, kindly if you go back, just Google, just equip yourself with facts. There are pamphlets here. No, read more about TB. I'm telling you, once you understand about TB, the difference that you can make is big. And that's one way that you can stop TB. So please, people, kindly know the facts about TB. And once you know it, the person who does your laundry, the person whom you work with, your friends at school, whoever, once you find out that they've got TB, then you won't be afraid. Then you would know the facts and you would give them the support. Because if this person doesn't get the support, this person is not going to complete the treatment. And guess what? As long as this person is not completing the treatment, this person is going to have TB. And guess what? You are next. So prevention is better than cure.
Okay, question.
Hi, my name is Mandy Sluicer. I'm with Action. And my question seems to be about the elephant in the room, the thing no one wants to talk about, the F word, funding. Right now, the Global Fund provides 82% of all external funding for tuberculosis, and it provides half the amount of people on treatment with AIDS treatment. The other half is provided by PEPFAR. Right now, the Global Fund faces a $2 billion gap, and PEPFAR cuts are proposed by $500 million in the president's budget. How do you think these cuts will affect your country and your homes? And what would you say to the international donors that are making funding decisions right now?
You know, tuberculosis is a silent killer. And if they will cut those funds, more children are going to die and more immigrants are going to migrate here and going to affect more people if they will not stop or get cured properly. It just happened back here in the States. They treated us a full 9 months and took care of us. Like in my country, in the Philippines, we never know the USA over there. But you know, I'm asking to preserve and put more funds on the TB, especially they always put malaria and AIDS, but actually TB is really causing a lot of children and misdiagnosed for all many people. But at the end, they will find out it was TB. So I'm just hoping they're gonna be more focused on TB, and as I said, put more funds on it.
Thank you for that question. I think it's a very good question. Probably we should actually discuss that, all of us who are here, not just the panelists. But I think to me, I would say if the cut in Global Fund to me means death. Why am I saying this? It means that the investment and the efforts that have actually been put in treating HIV and TB in Africa will be gone. All that gain will go down in drains if we cannot sustain it. So many people are on treatment right now. So many actually eligible to be initiated on treatment. And so many new infections are taking place. So I don't think it makes any sense. It implies that, let me give my own example. I know if I don't get my ARVs around second line, probably I might have one option. Good enough, I now have good friends here. It is not in Africa, we don't have that line. I'll just cry for some of you to be able to take me to that line if I don't get my second line ARVs. Now what I'm saying is that if the Global Fund, the PEPFAR, USAID close shop, then I think I will die in the next 6 months. And most of us will die. Millions, billions of people will die within that duration of time. So it means that, and it is actually a grave violation of human rights. Why did you have to put us in ARVs on treatment in the first place if you knew you would not sustain it? So it's not something that you can take lightly. Secondly, there have to be mechanisms for governments to be able to take responsibility. The Abuja Declaration, we need 15% on help, so that at least whatever we are getting from the Global Fund and other funding mechanisms should leverage what the national governments are putting on help. So we still have to push our national governments to be able to rise to the occasion and contribute the necessary 15% of the budgetary into treatment or into health.
Now, we are not asking to sustain the fund, but we ask for more, as I told you before, many of the TB patients are waiting for, TB medication. They are waiting list so that they can get the medication. So that we ask for, more fund, and because you have a chance and a privilege to save many lives, so that you don't have to, you have to invest your money. It's good to invest your money on buildings and bridge and many things, but investing on people's life is much better. Not in this world, but
in my country, people now, the patients now are receiving free treatment, and it's come from this global fund. And thanks to this fund, many people in my country are cured and have a better life, including me. And I can imagine that without this fund, how a country like Vietnam can deal with this disease. Thanks.
Okay, consider this. Someone is on life support, and this person's life depends on the machine, and you switch off the machine. So at the end of the day, while this person is on the machine, getting the life support, the doctors and the medical staff, they are looking for ways to get better treatment for this person, so that this person can then start to survive on his or her own. So that's kind of in some symbolic way. If, for example, a person who is on treatment and who is getting the medicine and who is on his way to get cured, later, if funding gets to be removed, then this person will not be able to complete it, and then it gets to drug resistant. And once it gets to drug resistant, that's when it becomes dangerous. And then the status gets more and more, and it gets dangerous. And once it gets to affect all of us, then, as it says, global fund, then it affects the global productivity. So it doesn't make sense. It doesn't make sense to stop something that is going to help us, the whole world, I'm talking about the whole world, that is going to help us to improve our lifestyles and our livelihood. So we need more productive people. We need people that can complete the treatment, because from what I also know of is we are using treatment that has been used for years, and new and more serious diseases are coming, and TB really, since it's airborne, it goes into these diseases, and at the end of the day, TB becomes stronger. And by the time we realize and like, oops, let's start focusing on TB again, then it's too late. So right now, while we can still curb this, I think we should continue fighting this, and we should try and see what better ways we can find to get rid of TB and stop it, so that our kids and the future generations really doesn't get affected by this.
Any other questions? We get a microphone in the front.
Hi, thank you very much for sharing your stories. I have a question. Most governments do provide anti-TB medications for free, and I know that many of you have mentioned that. However, we do know that there are so many other costs that patients will have to incur through the 6 months or the 8 months of their treatment. We know that many patients are unable to work during this time of treatment. We know that many patients have to go live with relatives and have the support of their family. We know that you have to pay for transportation to the clinics every single day. So there are lots of other costs. And we know that there's a very large population of patients undergoing TB treatment who are already very poor. And so this type of continuous economic hardship continues to push people further and further into poverty. So what can we do? I mean, how can we ask governments and how can we ask other donors to try to help break this cycle and to help provide more support? And another kind of side question is in terms of the social support needed, just the everyday kind of helping patients along. I think we haven't really talked a lot about those two aspects of what it means to undergo treatment for such a long period of time.
So,
I just completed my Master of Social Work degree, and that's why I am seeing the intersection of all these needs for persons that are going through the treatment process. Yes, definitely. The family support is the network or the safety net for this person. When that's absent, then society and other groups kind of need to step in. One of the discussions that we've had among this panel is that wouldn't it be great if we could support each other, if there could be a support group from former persons affected by TB who are still actively mentoring the people that are newly diagnosed. Also speaking up and getting support from the transit system, the DC TB clinic or personnel were talking about getting incentives for the people under treatment, getting McDonald's vouchers, because some of these medications, if you take one on an empty stomach, they have higher side effects. So just ensuring that a person is getting a meal when they're taking the medication, psychologically, going through depression, going through the isolation of being quarantined, all of that definitely needs to be addressed. In mental health, there's a concept called the wraparound process, or providing the whole person approach to whatever needs the person is expressing. And definitely that would help with treatment adherence, with dissemination of information, and elimination of TB in those communities where they're involved in the process. So that would be my recommendation, to really look at the whole person, the needs for that person, and try and fill as many of those gaps as possible. And because it's a domino effect. If one thing is not working, it affects everything else.
give one example of patient support, lack of it. Back in Kenya, we are currently right now advocating for access to treatment for one of our SDR patients. There were 3, but 2 of them died, but 1 is still surviving. This lady is not supported by anyone. It's the family that is, and friends actually. We are donating to sustain that patient. And that's why I repeat what I said yesterday, that the TB programs need to be expanded. The guidelines should not cover just the completion of treatment, but also take care of adverse side effects that may come thereafter, most of those who are MDR and SDR treatment. I've seen so many people in my country abandon treatment because they don't have food to eat as they take their medication. And this is very true. I experienced it. And even right now, I'm still experiencing it. In my second line treatment for HIV, there's a drug called Caletra or Aluvia, for example. You can't take it on an empty stomach. How about if you have TB? And now with the TB medication, especially the intensive 2 months, it's not possible. Most patients give up at that stage. I think it's right time we come up with innovative ways of how best we can be able, the programs can be able to support TB patients to be able to complete their treatment. In terms of transport, surely in some of our settings where we come from, the patients have to travel up to around 7, 8 kilometers or 10 kilometers to the center where they're getting their medication. It becomes very difficult, especially when you're weak and an empty stomach, you want to walk for all those kilometers for you to get your medication. You just give up and die. So as much as we're giving drugs for free for TB, can we extend something a bit to be able to cover transport and nutrition? It is not asking for too much. You are giving drugs. Thank God the drugs are cheap. They are affordable. How about just putting a little bit more to cover for transport and also nutrition for this person as he or she is on treatment? This will definitely encourage TB patients to complete their medication on time and be able to adhere to their treatment. And by so doing, we will actually be reducing the number of XD or MDR cases drastically and making management of TB not to be abandoned, but to be something that is manageable.
We're nearing the end here. I wanted to ask one last question to the panel before we conclude. The people in this room, to a large extent, are a self-selected population of people that care about TB. Where most of us are not politicians or legislators, and we're just regular people. What would you ask that we do? What can we do when we leave here today to help this struggle?
Continue to talk about it. Would be my recommendation. Continue the discussion.
I think for me is just to share what we experience. It's already give impact to people, so they won't experience the stigma and everything. Just share, and like for me and her, we're not scared to speak up what we've been through.
Thank you. I know most of you has been put. Actually, I know you have a passion for TB. You spend most of your time in addressing matters that can actually eliminate TB. And by seeing TB patients whom you're working hard for alive and kicking, I think that becomes a motivator. I'll just ask you that some of you are actually privileged to get in forums where policies are made, global policies, national policies on health. You can do your contribution. You can push for our cause. You can have our voices. You've heard us talk. We've interacted. You know what we undergo. You may not be there with you, but you can remember some of these words that we say earlier, we've talked here. Please be our advocates in whatever forums where you are, so that at least we can take TB advocacy to the next level. We move away from the staircases into the boardrooms, where we can be able to argue and be listened to. And then policies will change to cover all those areas that we talked about. Be our advocates.
My advice would be, we are your success, so that you don't give up until you hit the target. So that's my answer.
It's easy to get TB, and it's easy to fight TB. How? You get it in there, and one of the ways that we can fight TB is by getting the facts about TB, to be knowledgeable about TB. And once you know it, and once you've got this information, what TB is all about, how it can be prevented, then to continuously share it. And let's not just say, okay, fine, I've done my part, I've talked about it, and I've covered it once, there was one article that I've done, and that's it, or yes. TB is a continuous fight. As long as it's there, and TB is going to be there. So let's break it, and together we can do a lot. So let's go out there, let's share it, let's speak to our kids. If we go home today, let's ask our children, do you know TB? Obviously, most of them are going to say no. But let's inform them what TB is all about. Let's also talk to them how they should probably not behave, but how they should act towards those that are having this, whether it's their fellow school friends or whatever it is. Speak to your co-workers. Talk about TB. As we are talking about the news and the sports, let's also talk about TB as well, and let's engage. And on our blogs, on newspapers, let's get the media behind this, so that the media can bring this to the forefront, so that TB can be also on the front, middle, and back pages, because it's something that affects all. So please, let's talk about this. Let's raise awareness. Let's spread awareness on TB. Let's not spread TB.
I just wanted to add on that. Sometimes you just have to use what you call the fear pill, because nobody wants to be infected with TB. And yet we share the same air, we are actually breathing the same oxygen. There's one thing that is a fact, that none of us is safe until everyone is safe. We are all vulnerable to TB. Spread that gospel and we'll get the masses on this. And we'll succeed in TB, the fight against TB.
I want to say thank you to you guys who are here and showing your interest and your care about TB. And if the TB patient in all over the world know about this, they will be encouraged and comfort so much. And they will know that they are not alone in the fight with TB. Thank you.
So as has been repeated, there aren't any populations or communities that are safe from TB. It's airborne, and it's contagious, and the simple act of breathing is a risk factor that none of us can avoid. We know that TB can take lives, and today we've heard from a diverse range of voices that's forced us to consider all of the ways that TB can also complicate lives and turn each day into a struggle for survival by patients and their families. There's nothing easy about having tuberculosis. In the case of Francis and Rachel, we've heard about complications stemming from co-infection with HIV and diabetes. Found and Faith both had TB multiple times. Andre has seen his family members pass away, and Indy struggled for treatment for MDR TB and saw other patients commit suicide because of how difficult it was. But there is hope. The presence here today of each of the panelists is proof of that. There's our stories of triumph, They're survivors whose spirit and optimism played a large part in their ability to get cured. They were faced with obstacles and they fought through them to become healthy, but patients shouldn't have to fight for their lives. And while there are countless organizations that are working day and night to solve this problem, I believe that we can do better. We can do more with the resources that we have, and we can do more to come up with new tools to fight against TB. As we leave the confines of this room and continue on in our routine and in our lives, don't forget the stories that you heard here, and don't wait for World TB Day 2013 to revisit these issues. 5,000 people died from TB today. 5,000 more will die tomorrow. We just heard from some of the survivors, but we need to ask ourselves every day what more we can do to ensure that everyone is a survivor. I want to thank everybody again for coming, and especially thank the panelists for their courage and for sharing their voices with us.